So I'm gonna now show y'all. Now show y'all what it is. Just like I said, even if you don't have tooth or gum problems, it's a good wrench to have in your house anyway. This is what it looks like. That's the name of it. Okay, this is kind of different from the other one, the other store. I'm gonna look and see, because this one is different than the other one I got. They rinse your mouth with 15, which is one capsule for 30 seconds, AM and PM. After toothbrushing, expectorate. After rinsing, do not swallow. So again, this is the name of it. Let me stop walking. Okay? So I was introduced to this before I got to the Bronx, way before I got to the Bronx. When they first started, well, they didn't start working on my mouth yet. I had went to the dentist. Well, I guess they was going to start working if I had kept going. But my gums all down here had swelled up so. I really didn't have problems with bleeding gums, but I had problems with swollen gums. My gums would swell up real bad. So they had went to do a cleaning. And that's what it was. They was doing a cleaning. And they was like, oh no, we can't clean your gums. We have to, your teeth. Your gums are inflamed. So that's when they gave it to me. And I started wrenching my mouth with it. And it wasn't long before them gums started going down. So it's good for swollen gums. It's good for infective gums. It's good for anything to do with the mouth. Oil or oral. If you have some, I'm go down here and see if I can get me some 2 AAA batteries. If you have some, what you call it? I said swollen gums, right? Any denture problems in your mouth. Oh, even if you have some sores in your mouth, it's good as well for you to wrench it up. Because I was wrenching, I let Tracy do his mouth too. I said, wrench up that mouth, baby. Because I don't want you to get no, because he's so hard-headed. He won't do what I say. So the least I can do is try to protect him. So I will make him go. I told them to make sure each time you'll go to give him his antibiotics, make sure he wrenches his mouth. Even though he's not eating, but at least he's not keeping the gauze on the mouth. So at least the wrench would help the blood from not, staying. Yeah, so that's the good thing. When I get in the house, I'm going to see if I can show you all the top where the surgery was done. Because I'm good now. I can still feel it a little bit. But once it completely heals, then that feeling is going to be subside. And I'm going to be back to my normal self without that hump in my mouth. Because now that it's not there, I'm so used to putting stuff in my mouth and holding it, and now I can just swallow.